In this video, we're going to walk through how to use Platinum Planner to manage your EMT clinicals. By the end, you'll know how to check your schedule, sign up for both ambulance and emergency department shifts, and properly document your patient care experiences. All right, so let's jump in. First, after logging in to Platinum Ed, you will find Platinum Planner here on your right-hand side. This is your control center. It's going to show announcements, upcoming shifts, and any pending tasks that you have to perform. And please always make a habit of checking the dashboard first. It keeps you on track and avoids missing any deadlines. Clinicals are called opportunities in Platinum. So first we want to go and see how we can sign up for these opportunities. So let's see what's available for us. There's a lot of data here. This is all of the fire rescue and ER rotations. So let's narrow it down. If you're looking to sign up for a certain day, that should be your first step. So let's look at October 25th. See, we have only one page. If you are sure of what ambulance station you're going to be at, either St. Lucie County, Indian River County, Martin County is here, Stewart, Okeechobee, these are all available on this day. And if you're not sure where, let's say Station 30 is, click on Sign Up, and you will see the map appear. You can zoom in closer, or you can zoom out. If you're happy with that location of the station, it's close by, you want to switch to the street. This is in Port Salerno. Then click Sign Up. If you're not, you can reject and it won't be displayed. Now, one quick note, Martin County and St. Lucie County require approvals, and that takes about 24 hours, where Indian River County, Okeechobee, Stewart, and Indian River Shores do not require pre-approval. Those are immediately accepted. You want to look at the emergency department. We have both Lawnwood and Rollerson hospitals. Rollerson is in Okeechobee County. These are 5-hour rotations where you observe in the emergency department. There's no documentation required. You just need to check in and check out. Now, once you've signed up for one of these clinical assignments, you will no longer see any opportunities. That is so you don't sign up for 2 on one day. Okay, so every morning at midnight, the shift that you're going to be in that day is put into Platinum Planner, and you'll see on your dashboard, it says an opportunity is ready to be documented. So when you arrive at your clinical site in uniform and you check in with the station supervisor or the charge nurse, if we're talking about the emergency department, you want to check in on Platinum Planner. This is your proof of attendance. So let's begin our documentation. We are at Station 4, St. Lucie County. This is right at the airport. If you have any problems, this is our clinical hotline number. Please take it down. It's 772-999-6146. Any issues, they're asking you to go to another station, or they are telling you that they're not going to let you ride that day. It's probably something else that's internal and it has nothing to do with you personally. Please call that number and speak to one of the faculty, even if it's a Sunday morning. We're monitoring this number all the time. Wait at the location until we call you back and resolve any issues that you have. If you are being moved to another station, then please just leave us a voicemail message saying that you were asked to go to Station 6 at St. Lucie County, and we will not have to respond back to you. We will change your station, and by the time you get to Station 6, you can check in there. We will have made the changes in Platinum. So now let's begin our documentation. There's a little pop-up that happens, and we're going to ask you to allow Platinum to know your location. This will show your GPS coordinates, and that will serve as your check-in. When you're done, you're going to be checking out, and we'll do the same thing. If you've already allowed your app or the website to view your location, then you never have to worry about it asking again. Now, let's say we forgot to check in, or there was an issue, or we got a call right away. That's fine. That's not a problem at all. When you begin documenting, you'll be prompted to check in. Please do not update the actual start time to this check-in time. You will lose any hours that you've been at the location. Once you check in, now you're able to begin your documentation. These are these tiles up here, these 6 tiles, also appear on your phone app, but they are on the top of the screen. So we're going to look at the information, and we are going to see that we have checked in. You don't have to do anything else until you check out with that attendance feature. Now, if you know who your instructor is, you know the name of your preceptor, it's defaulted to me. I'm the professor of this clinical course. You can just look for your preceptor and type their name in, and it can be starting with their last name. So let's say you are working at Station 4 with Mitch Farrell. That's him. You can select him, and now you've changed from me to Instructor Farrell. We have a large library of preceptors who are employees at the various fire rescue stations. We ask that you please document every patient you encounter who ends up being transported to the emergency department. So lift assists, refusals, they don't need to be documented. We ask that you are engaged with 5 patients that are transported to the emergency department. So that's a complete ambulance run. And that is a graduation requirement. It is a licensure requirement in the state of Florida. So how do you add a patient? You can do this at any time during your rotation. It doesn't have to be live. It can be done anytime. You can do it at the emergency department. Once you finish dropping them off, you can return to the station and do it. But how do you add a patient? So this is a live patient. It's not a simulation. The contact type, you can click on Basic Life Support. And the chief complaint. What was the reason they called 911 and requested transport? And you can see there is a lot of different problems that can occur. So let's say this patient is complaining of chest pain. You can ignore the time, you can make the current time, you can change the time whenever you. That is an optional feature for you as an EMT student. We do ask for the gender So this is a male patient, and we're asking for their age. And we don't want you to have to do math and figure out that they were 55 years old and they were born in September. You only have to do years. If it's a child that's just been born, they're barely 2 hours old, that's fine. If it's an infant that's 5 months old, that's what you would enter. And if it's an adult, in this case, it's a 55-year-old male complaining of chest pain, then that's the only age you need to enter. We'd like you to give a brief narrative, and you can discuss the narrative with your preceptor. And as we have discussed in class, there's different ways that we can present a narrative, but a nice summative narrative is enough. 55-year-old male complaining of chest pain, cardiac history, transported to the hospital. You don't have to give any information about what the paramedics gave in terms of medication, right? But just an overview. What you saw, what the patient complained of, and what their outcome was. And the outcome was transported to the hospital. Now, this is very important because this is where you get credit for this call. So the only skill that we want you to do is clinical contact, and then hit successful. And once that's done, you're going to hit save. So that's the only records that we ask for when you are performing this documentation. At the end of your rotation, we would ask you to fill out an evaluation about your preceptor and the site. And this is a Likert score. 5 being it was fantastic, it was all right, it really could do a lot better, this was terrible, or this doesn't apply. And when you're in the emergency department, there may be some things here for fire rescue that don't apply. This is a quick survey that is part of your outcome. We want to see if you had a good experience at the end of your day. And if you need us to follow up, please reach out to your professor in class. This tile documents, we don't utilize this. This is a feature of Platinum Planner, but not utilized here at IRSC. Now, when your shift is over, you can meet with your preceptor and get a feedback how things were. And if needed, you can send a message, but not really required. At the end, you want to submit your documentation. And like we talked about when you first arrived, we do not want you to update the actual time and date. You can submit this documentation within the last half hour of your ride or observation in the emergency department. You can also do this when you're sitting in your car before you head out, but we want you to really submit your documentation before you leave the site so it verifies that you were there at the site for the whole shift. And when you're done, hit the blue button, submit documentation. And you can view your opportunity progress right here under skills. Again, you've completed 3 of the 5 minimum patient contacts. They do not need to be documented while you're at the emergency department. This is only for ambulance transports. Going back to your opportunities, you see a list. Nothing is there for you to document. Today's ride was submitted, and once it's approved, it will drop into this tab. If you want to see what you have upcoming, this is the Rollerson Hospital Emergency Department that we've signed up for earlier, as well as in place of Indian River County Fire Rescue. Now, if you change your mind, something comes up, you just can't ride, you can always make up the rotation. We don't need a reason, just request a removal. There are no excused absences in this program, and anything that you don't sign up for, you're going to have to replace. So if you don't go to a rotation, you're going to have to make it up. And it's that simple. We'll get notification. And we just ask if you are sure that maybe you made the mistake, mean to pick Rollerson, you meant Lawnwood Hospital, do a request removal as soon as possible. What that does is it reopens it for your fellow students to now be able to sign up. Again, if you have any questions about the use of Platinum Planner, reach out to your professor in class or myself. Send me an email through the Canvas portal, and I'll be happy to assist you. Thank you so much for your time, and best of luck in the program.